Good day, everybody. Today, for our large animal lecture, we will be discussing the surgeries of the head and the thorax, and I will be using partly the presentation made by Dr. Jessalyn Constante for this topic. Some of the surgeries of the head and the neck are seldom done, and because they are very challenging, I have not been able to do all of these surgeries myself, but I will share with you those that I have done already as we go forward, as I will share some of my experiences and some of my strategies doing it in the field setting. So some techniques would require general anesthesia and or special instruments. And it's always important to aim for a sepsis, even if it's in the field setup, in order to promote the faster recovery of the animal. We are aiming for less complications as possible. So we start with disbudding and dehorning. And I will be inserting my presentation. So I will go side by side with my presentation trying to discuss this part. So disbudding is actually just removing the buds or debudding. That is before the full growth of the horn of the animal. But when we talk about dehorning, it is at the later stage of the age of the animal, so the horn is already fully grown. So we cannot use the procedures mostly being done for the budding or disbudding with the horning because they are entirely different. So the indications or reasons for doing such is to improve stocking density. So if the animals, large or small ruminants alike, do not have horns, then we can pack them more heavier in a particular field. So we can put more rather than if they have horns, then sometimes they would be bumping each other. So the horn will take up space surrounding the body surface of the animal. So that will lessen the stocking density. So doing this procedure will also prevent injury to both the veterinarian and the workers. It will also lessen the injury or possible trauma to other animals in the herd, could be udder or skin trauma, and it could also correct any injuries or fractures of the horn. And I have a very good example of that I will show later on. The first example or procedure on how to do disbudding or debudding is with the use of caustic compounds, and this is time bound. So meaning it is ideally to be done to small, young ruminants of at most 1 week old. So as soon as the animal is about 3 days old, you try to palpate for any of the horn buds. And ideally, when it's starting to emerge, is the best time to apply the caustic compounds. And by experience, it would be too late to do this procedure if the young animal is already more than a week old. So your upper limit is really 7 days. So before that, you really have to be on top of it and try to palpate for the emerging horn buds. And if it's over that age, then you may use the disbudding iron up to 2 weeks old. And then other tools that you can use in the field will be the Barnes dehorner, the Roberts dehorning trephine with the disbudding iron, because there will be some bleeding and you want to address the hemorrhage through the disbudding iron. And that will be appropriate for young ruminants aged 1 to 4 months old. And for those that are older, then you may be requiring the use of an embryotomy or phytotomy wire or a dehorning saw. Those are for the full-grown horns. For analgesia, we have, for large ruminants, we have the cornual nerve block and then the rim block, as shown in the picture here. And you will be infusing the local anesthesia right at that spot. Okay, just to give you more in-depth information about where that is. So we're trying to aim for the cornual nerve. And we are also being shown here the superficial temporal and artery and the auricular palpebral nerve. But we're for large ruminants, we can just do with a corneal nerve block and then a rim block. case ring block surrounding the horn that we want to cut. Okay, and this is another figure showing us where the cornual nerve is, which is on the number 7. Okay, so that is just above the eyes, but a little bit lower than the midline of the eye. Okay, this is a video showing you or demonstrating how to do the corneal block on grower.
Perpendicular is aspirate.
Kaya nangyayari natin yung kabila. Palabatin na lang yung patunod mo.
Okay, that was nicely done. And after infusing the local anesthesia, you have to massage so that it would easily disperse the anesthesia in the area. For small ruminants, there's a slight variation wherein we have to infuse in 2 spots because it has 2 branches. Now, the corneal nerve has the infratrochlear nerve, and then we have another corneal branch of the lacrimal nerve, which we have to address. So we will not be doing the ring block anymore, but we will need to do these 2 sites for the cornual nerve block. Okay, this is the picture showing you the infratrochlear nerve corneal branch infusion of the local anesthesia. Okay, for disbudding, it is discouraged to use caustic compounds, but most of the farmers would revert to this because it does not, it has less bleeding. So they will not be requiring, or if they are afraid of handling blood, so it will be more manageable for them to do this. Okay, we have some guidelines on how to be successful in performing this disbudding with the use of caustic compounds. Okay, and example of such is the sodium hydroxide or the potassium hydroxide. But we do not really handle these crude materials or crude compounds or chemicals. Instead, we use the commercial items already. So we can use Dr. Naylor's or Dr. Larson's. Okay, I have my presentation for that that will be shown later on. So in here, there's some techniques as well. So you have to clip the hair around the horn buds. You have to palpate the horn buds to make sure that you can feel the extent of the growth of the horn buttons, and you have to clip the hair surrounding it, so that's easier for you to isolate and then to visualize where you will put the extent of the caustic compound or the dehorning paste. And then you apply protective petroleum jelly surrounding the clipped hair so that any spillage or any leakage will be addressed by the petroleum jelly. It will not go further beyond the ring where you put in your petroleum jelly. And you only apply a thin layer. Either you use an applicator, a wooden applicator, stick, a spatula, or if you don't have that, you can use your fingers, provided you are wearing gloves. But this is not the best practice. So what we usually do is still wear gloves and then use the wooden applicator stick just to be sure. Okay, and you can find the animals for 30 minutes. This is to ensure that it will not be wet, it will maintain dry, it will be kept dry, so that there will be any spillage or leakage that will be flowing to the face of the calf, and that will burn the skin cells. Okay, and that's an accident that we don't want to happen. So another method is this disbudding iron, and this can be done manually, or in this particular case, this is electric dehorner. And this is widely used in Australia, New Zealand, and in the United States. But we rarely see this tool actually here in the Philippines because we usually do it the crude way or the hot iron cautery method. So the hot iron, with this electric dehorner, it has a like a circular end to it. So with the hot iron, because of you have plugged it now in an electrical socket, so it will get hot, and then it will now burn the skin, and you have to rotate it so that it will be pushing the skin cells and removing it, detaching it from the rest of the skin. Okay, so it will burn the skin and it will detach it. And once you can see it detached from the rest of the skin of the head, then you can scoop it out. Okay, so that's essentially how we use the um, electric dehorner. Okay, and this can also be done like with the hot iron cautery. So not only do we press it, okay, but we can also rotate it to scoop it out, okay? But mostly, I will be showing you the procedure that we do here in the Philippines. So if in case that there is a flat area, so the horn bud has not emerged fully yet, so we can just press it down with the use of the hot iron cautery. So we're going to flatten it out, okay? Flatten it out, and that's possible. So you're going to kill the horn cells, and when you flatten it out, it will look like this one, and it will not grow anymore. Okay. Another tool that we can use the Roberts dehorning chaffine, and the same local anesthesia that will be employed or will be used will be a cornual nerve block. Okay, so this one, this is not hot because it's not plugged, or the key here or the strategy here is the rotating manner so that you can detach the horn skin to the rest of the skin of the head. Okay, and then after you have detached it, the more you turn it clockwise, 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 and then you will be able to scoop it out. Okay, so there may be a need for you to use blunt dissection or with a scissors, a curved scissors, so that you can remove the skin from the rest of the head. Okay, so this will be requiring more steps and more tools using the Roberts dehorning chaffine rather than using the electric dehorner. Okay. When the animal is on the grower stage, so there's already a horn bud that has emerged, but the horn has not really fully grown yet. So you may use this saws, shears, or wire. The position is the animal may be recumbent, laterally recumbent, or standing. In this particular case, the picture that will be shown later is the animal is on lateral recumbency. So it's a combination of a physical restraint and chemical restraint because you need to press down the animal, or you will need a crusher shoot if in case the animal will be in a standing position. This is just to refrain from any unnecessary movement that may cause for further trauma to the animal. The chemical restraint will be the same. Analgesia will be through the corneal block. At this point, there is still no need to sedate the animal. So the technique here is to include 1 centimeter of the skin around the base of the horn. So you can expect that this may be bloody. So it's important also to prepare your hot iron cautery to address any hemorrhage. Okay. So this is your Barnes dehorner. And this is mostly being used for animals more than 2 months old. So for the dairy cattle, 3 to 4 months and maybe up to 5 months, but 6 months may be a little more challenging depending on the size of the Barnes dehorner that is present or available at your farm. But you will need someone really strong because when you press the two handles together is when it will cut the horn. So it may be challenging for a person like me. So it has to be someone with muscular arms to do this. Okay, so this one is a video again to demonstrate how the barns dehorning.
Patayo. Perfectly. Yan. Scoop. Yan. So, steady guys ha, handlers. Yung ano na. Yung next. Yung ano na. Ay, asa? Bukan mo. Tapos medyo i-twist yun. Good job. O, tingnan natin. Hindi mo to.
May bugas na natin.
Sorry.
Okay, so since this animal is probably 3 months old to 4 months old, so the horn stump is still not so big, so it was easy to apply the bars dehorner to do the job. And we see some bleeding right here that can be addressed through hot iron cautery or just with a gauze bandage or gauze pack. Okay, these are video clips again.
Agad para makapatin dugo.
So, press mo siya ng gano'n. Tapos ka siya i-hand.
Kamay po ng
Okay, to lessen the smell of burnt skin or burnt hair, so it would be better to cut the hair surrounding the horn buds. So you can also easily see when to apply the hot iron cautery, such as this one.
sige.
Yan yung may butas, hindi yan yung flat. So, center ka lang mo.
So, hindi na po siya kailangan
Dahil,
ulit.
Papo, sa punong baka natin, hindi natin kailangan.
Okay. Now, this is another procedure using embryotomy or fetotomy wire. So we usually use this tool if the horn is already fully grown. And this is for mature animals, be it large or small ruminants. Okay, the key thing here is the one handling the both ends of the wire should have like precision or greater control of the direction so that you will still have a plain line when you try to cut the horn and not go everywhere else. No, if you're moving to the left, to the right, or in another plane, so you will have a clean cut still of the horn when you use this embryotomy wire. Okay, for older animals that are more than 6 months old, some of them would really present with a opened or like this a frontal sinus. And we can just adjust this by putting gauze pack and making sure that no flies will be surrounding the area that will cause myiasis later on. This is another picture to show you how it is done or how it is used in adult small ruminants as well. Okay, so we want to lessen any occurrences of having to manage or monitor open frontal sinus. So in my experience, when I'm really trying to dehorn mature animals already, I don't cut it to the base because at some point, the frontal sinus will still have a covering out about 2 inches after the base. So I just want to lessen the post-operative management that has to be done at the farm because sometimes, I cannot really rely on the staff to monitor them. So just to lessen the work that they have to do. So I would do this changes, not to really cut on the base so that I will not have any open frontal sinus. Sometimes, even if I cut them at that stage, so on both sides, one horn will be covered by a sheath of the frontal sinus, but the other one or the other horn will be open. So at least I have just one horn, open frontal sinus to manage. Okay, so it's not always the case, even if it's at the same level where you cut both horns. Okay, this is a diagram to show you the frontal sinus. So the more that you cut through the base of the horn, the more that you will have an open frontal sinus. So what I'm telling earlier is I'm cutting more of about 2 inches from the base of the horn. So at least the frontal sinus will be kept close. Okay, that will remain sealed even after cutting the horn. Complications may be sinusitis, but this is quite rare in cattle. But I have handled some, okay, not too many, some cases in small ruminants. And in fact, when I was in my undergraduate years, the other group, like in our class, had a mortality of their of their sheep because of sinusitis. I know, actually, not specifically sinusitis, but myiasis. So we really want to lessen having an open frontal sinus after the surgery. So the post-operative procedure to do is quite simple. If it's closed, the frontal sinus is remained sealed. So we just have to do the appropriate wound management, the usual betadine, and then we have the wound spray. And just making sure that it will remain dry and there will be no fly infestation. Okay, so before I proceed with that, let me show you my other presentation on dehorning.